to the dissemination of accurate, verifiable, and credible news and programming to inform, educate, and entertain. Videos. iRadio, your eye on South Sudan.
Welcome to the Sundown Show. On this show, we bring you the movers and shakers of South Sudan and the world over. We engage in debates and discussions that unearth the stories behind the news. And we have our light moment, your eye on South Sudan.
أهلا ومرحبا بكم في برنامج سانداون على آي راديو. في البرنامج ده بنستضيف شخصيات بارزة ومؤثرة من جنوب السودان ومن حول العالم، وبنتحدث معهم عن القضايا اللي بتهم بلدنا وبتأثر على حياتنا. كمان بنتطرق في القصص خلف الأخبار وبنتبادل الأحاديث الخفيفة عن حياتنا اليومية. شاركونا، كونوا جزء من البرنامج فقط على آي راديو، عينك على جنوب السودان.
إحنا كلنا جنوبيين سودانيين، ما مهم منو جاي من وين. إحنا محتاجين نحترم بعض وندعم بعض لأنه إحنا واحد. إحنا كلنا بشر كسودانيين جنوبيين، بنستحق عشان نعيش بالسلام، نستحمل بعض ونصالح خلافاتنا ونعيش بالسلام. ده رسالة تسامح والتعايش السلمي بيجيك من آي راديو، عينك في جنوب السودان.
This is a message of peace. We all are South Sudanese. It does not matter where anyone comes from. We need to respect each other and support each other because we are one. We all are human beings. As South Sudanese, we deserve to coexist peacefully, tolerate one another, reconcile all our differences, and live peacefully. This is a message of tolerance and peaceful coexistence brought to you by iRadio, your eye on South Sudan.
Hello and welcome to the Sundown Show on iRadio with me, Madrama James. Today we turned our focus and talked about health-related issue. The Ministry of Health, with technical support from World Health Organization, also known as WHO, UNICEF, and partners with funding from that BMGF through Global Polio Eradication Initiative, have again kick off implementation of sub-national polio vaccination campaign second round in 40 high-risk counties across the country. To shed more light on this initiative, I'm joined live in the studio by Dr. Samuel Lapati, immunization specialist, UNICEF South Sudan, and George Awizenio Lege, EPI Director, National Ministry of Health, Republic of South Sudan. Good to have all of you in the studio. Welcome. And to first start with, I would like to invite Dictor to briefly take us through about this initiative. Welcome, Dictor.
Okay, thank you very much. As the presenter Madrama James said, I'm Dr. Samuel Pati, working with UNICEF on the immunization program, expanded program on immunization. So this initiative started all the way from 1998 when the global community have seen that polio disease is a disaster, making paralysis in children, especially children under 5 years of age. So since then, when we were One Sudan up to South Sudan from 2005 or 2011, we continue to vaccinate children under 5 against polio disease, and the vaccination is also part of the routine immunization. But once there is an outbreak or a case is identified in the community, we always go for campaign settings. So we have done several of these campaigns. As a result, Nowadays, you don't see a crippled child because of the virus, but it had been an issue. Even in South Sudan, there are many people with the disabilities as a result of the disease. So polio vaccination is a vaccination targeting children from day zero. If a child is born today up to the age of 5 years, these are targeted because they are the most vulnerable in the communities that can get the infection through water which are contaminated with the feces or stool. If a stool of an infected person goes to a source of food or water that they use, then there is a likelihood of children getting infected with the virus. Yes.
And someone would like to know, why is this particular vaccine at this time? Is there any other crucial or health emergency issues within the country?
Yes, you might know that since June 2009, that was the last time when wild polio virus was detected in South Sudan. And after that, there had no report of wild polio viruses until South Sudan was declared free of wild polio virus. But as of recent, like earlier this year, a case vaccine-derived polio virus was detected in Wow, and this instigated our made it that an emergency vaccination campaign should be set up, like a ring campaign, to prevent the spread of that one case from Wow to other areas within the country. As a result, 40 counties with around northwestern Baragazal have been targeted for children in these areas to be vaccinated. At least like 2.1 million children are targeted in these 40 counties to be vaccinated. And since that case was identified, there has not been any case reported across the country, but that is already a threat. That's why UNICEF with the WHO under the leadership of the Minister of Health decided through the Global Polio Initiative that a campaign should be done. And we have done the first round. This is the second round we are doing to make sure that there is no spread beyond where the case was reported.
Well, before I invite in Mr. Jocha Wizenio, I would like also to know from you a quick one. Why only 40 counties within South Sudan, and how about the rest of the counties as well?
Okay, these 40 counties are high-risk counties. For example, when you take counties around northwestern Baragazal, the three counties of western Baragazal, that is Raja, Juru, and Najiro, these are factored because even if the case is only in Wow County, but these counties a lot of movement of people are happening. People from Wow can go to western, Warab can go to northern Baragazal, can come to western Equatoria, can come to Equatoria, Juba here, and go to other parts of Greater Upper Nile. As a result, all areas around that state has been targeted. For example, the counties in northern Baragazal, Warab, and then the counties close in western Equatoria like Tambur, Nagiro, Yambio, these are all targeted. And when it comes here, Juba and other areas also targeted, so that where there is a lot of movement of people, we have to make sure that these areas, these children are protected against spread of that one case.
All right. Shortly, I will be also expecting another speaker right here. But before I do that, I would like to invite in Jocha Uzenio Lege, who is EPI Director, National Ministry of Health. First and foremost, what is the government response into this vaccination campaign? Good to have you.
Okay, thank you. Yes, I think what is the government response? The government is responsible for all these activities that is happening inside the country. UNICEF and WHO and the other partners, as we are talking about the partners, those are partners of the Ministry of Health. They're supporting government to implement its objectives. So this the role of the government is bringing the partner in one place to coordinate and implement these activities to protect children of South Sudan. Yeah, I just want to add something from what Party responded. Why the 40 counties? Some of the counties, yes, they are far from northern Barghazal, from western Barghazal, even far from Juba, but because their coverage of routine immunization was very low, this is why they were being included to become the 40 counties. Because once the county don't have higher coverage, means their children there is at risk. Their immunity will be low, means it's showing that there is immunity gap. This is why those counties was being added. Yeah.
Thank you. Good to have you, though late, but never at all. And it's a time now for you to say hi to our audience as we kickstart also this show. Welcome.
Thank you very much. Good afternoon, listeners, and thank you for having me.
All right. We learned that WHO is providing support to the Ministry of Health plus some other partners to make sure that this vaccination campaign is successful. Tell us more about that.
Okay, thank you very much. The WHO leads the Global Polio Eradication Initiative efforts to ensure they support countries to respond to every threat of polio virus that is detected. So this is achieved through the leadership of the Ministry of Health and other GPI partners, the UNICEF, the US CDC, Rotary International, Gavi Alliance, as well as the Bill and Melinda Gates Foundation. So this is a very big collaboration that support countries that have outbreaks and they need support to respond to this outbreak. For the first campaign we got support. Second round is what is currently going on, and the aim is to ensure that all children are vaccinated from 0 to 59 months. They receive 2 drops in the mouth of every child, and irrespective of their vaccination status during the campaign period. Thank you.
Thank you. Thank you very much. Over to you, George. Currently, what are some of the polio threats in the country? You are in charge of that API. Who would like also to know?
Okay, thank you. I think I even answer some. One of the threats is the lower immunizations coverage in the country due to many reasons. One of the reasons is the access of the populations with the routine vaccinations. And secondly, the insecurity in the country. We have a problems to reach some counties with the vaccines. So these things is a threat to us, so that it's not giving us chance to reach the children with the vaccines to protect them from the polio virus. Yeah.
All right, over to you, Patty. Add-on?
Yes. As he said, why it is threat, because South Sudan is receiving refugees from Sudan. There are high influx of refugees. For example, the cholera outbreak we have, it started all the way on the other side, and it got imported, and then when it arrived here, it affected almost 9 states out of 10. And the neighboring areas like Somalia, there are a lot of people movement, because there are some outbreaks in those locations in neighboring countries. So polio is still a threat to South Sudan because of the higher population movement globally, and also in other countries globally like Pakistan and Afghanistan. There are still wild polio virus cases happening, and with the movement of people, you can get these people on the ground, And as the community of South Sudan and the government of South Sudan, there is a need to ensure that children are fully protected so that they don't get this virus again happening in South Sudan, since South Sudan has been declared polio free. So any case we vaccine derived we see like that, this is already a threat, and we have to contain the outbreak.
All right. Mr. George, you said, of course, polio is one of the threats right here in the country, but still, when it comes to issues of that vaccination, we'll definitely have some skeptical communities who feel like, vaccines are always dangerous. Now, tell us some of the signs of this particular vaccine, and what would be your message to the skeptical communities who feel so reserved to take about this vaccine?
Yeah, okay, thank you. Yes, I think one of the reasons of some communities to be skeptical from the vaccinations, this is just ignorance, because they don't know exactly what is the importance of the vaccines and the benefit of the vaccines. And some of them is just taking based on the rumors, and then they take it like become something that is right. So that is our main enemy. This ignorance is the one causing all these things. But in South Sudan, there is no bigger number of the populations or the communities that is refusing the vaccine.
Yeah, you mentioned of rumors. What are some of the rumors lingering around within these vaccines?
Yeah, some of the rumors, some people are saying, this vaccine's been given to children so they will not produce in the future. So these are the rumors that people used to say. But that thing is not right, because I think I said it here. I say government is not accepting that something that will harm its population.
Right.
So we will not just give the vaccines for all children. For example, this round, we are targeting 2.1 million children. Is it right for government to allow such things to happen, to sterilize all the children in the country? And then who will be the future of these countries? Those children is the future. Because for the government is not governing what? It's not governing animals. It's not governing trees. It's governing human beings. Yes. So any government, he need more people. He needs his population to grow, so that populations will be a resource, because it's the same. It's a human resource for building the country. Is the resource for the tax, because government working because of the taxes that is taking from what? From the people. So without people, the government will not be a government. This is why government need people. Government bringing vaccines, bringing drugs to protect his people, to make it continuously, because government need the people. So this such of the rumor that is coming, and it's not true, and people even they can testify it that things is wrong. And all of us know, somebody like me, who have been born in the 70s, those days there is many crippled children, but these days it's not there. Why? Because of the vaccines. One of the things, measles, people been dying those days, but now it's not there. Those days when we were small, in the earlier 80s, this called cot, the whooping cough. Children will cough until cry like a cock. But these days, those things is not like that. Why? Because of the vaccines. So we want to tell the people that all the rumors that they are hearing is not right. Government is working for protecting of the people, so that it will govern those people, because the work of the government to protect his people in many ways.
All right.
Yeah.
Joshua, what's WHO doing to ensure that the drugs or the vaccines are also safe, more especially to children?
Okay, so thank you very much. So what I can say is that the vaccines are safe, completely safe. and they are of high quality because they are manufactured under strict regulations by UNICEF, WHO, and also the Ministry of Health. So we don't just get the vaccines without the government making a request and making recommendation, and also the manufacturers are regulated. This is pre-validated, validated to ensure that it's safe. For this vaccine, it's completely safe. It's not known with side effects. However, some injectables vaccines may have mild adverse events following immunization, which could be treated. But with novel polio, oral polio vaccine, which is used currently, is a stable vaccine. It's not known to seed to cause paralysis. Is much more stable than the previous ones we have used before during outbreak response. And also, the more doses a child gets, the better the child gets resistance to fight against the disease, the paralytic disease. And I think this is what I can say about the safety and the efficiency of the vaccine. Thank you.
All right, two questions to Patty and Mr. George, whether these vaccines are for sale, and what are some of the initiatives to make sure that all the centers within the 40 counties at high risk have also the vaccine. Let me first start with Patty.
Thank you, Madrama James. This is a very good question. What I want to listeners to hear from us as the expert is that all the vaccines, including polio vaccines in the country, are provided free, not for sale. Whether it is in the private clinics, private hospitals, or NGO facilities, government facilities, they are free. So the polio vaccines that we are dispersing right from yesterday to the under fives, it is free of charge. It is only the workers that are paid through WHO. This is because they are covered, so they need not to take money from any of the beneficiaries. And if it happens in any of the locations, a beneficiary should report to the nearest facility or police, so that that person is arrested. It is free of charge. And as my colleague Sule said, Dr. Sule said, it is safe and a potent vaccine, because right from the manufacturer to the country until it reaches the beneficiaries, they are kept under tight temperature conditions. So we are confident that this vaccine is free and is potent and can give a very good outcome to the 2.1 million children we are targeting.
All right. Over to you, George. What are the government doing to make sure that the vaccines are within the 40 counties that are at high risk?
Okay, thank you. Yes, as Patty put, the vaccine is free without any paying any coin of the money. And the role of the government, as I started from the beginning, we are doing the coordinations. This work is a government work. UNICEF, WHO, and other partners, they are supporting government to deliver this service. All the activities that is happening now, right now in the states, being led by the government, the state and the counties, they are the one leading. And the only things that UNICEF is doing is, or WHO is paying the incentive to those workers who are doing the work, but the staffs was being mobilized by the government team in the states and the counties and the PIAMs. So the role of the government is to coordinate and arrange things in the right way to prepare the committee, the teams in the ground to reach the children. And strategies is not going to be a fix, like you say that the centers. For polio especially, we are doing house to house. The team is the one going or go to the houses and vaccinate the children within the houses. This for the polio campaign especially. But for routine immunizations, yes, this one in the health facilities, as a party put, if in the private or the public, is a free of charge. Yes. So our role especially is a monitoring role. We have to monitor the activities that been done in the right way, and to see those who are doing in the like in the government health facilities. Some people is requesting money, and when we just heard about that, immediately we'll go there and stop not to happen, because the vaccines is a free of charge.
All right. Yeah. A quick question from that side. Patrick, who is following us live via Facebook page from Nimule Municipality in Eastern Equatoria State, that one of the challenges is low incentive for vaccinators. For example, vaccinators that took part and partially in the first roll, up to now they are not paid. What is the ministry doing?
Yeah, this one, I don't know what is the problem exactly, but from my informations as a EPI director in the national level, I know all the teams was being paid in the state. This is why we're starting the second round. We normally will not move to the second round before clears the first round. So if that things happen, I think it's the mistake. I will try my best to dig it, especially with the team of the Central Equatoria, what is the reasons of the vaccinators not being paid up to now. So that one is our role. We'll look for it. And about the lower, the payment, from my side is not a lower, because the situations of the country is the one pushing us to see that being paid is the very small, because this rate, the one being paid today, this is the rate somebody like me, since the time I came to EPI 2004, we have been paying the same. Yes, you are seeing in the pound, it's very small, but that rate is a rate of the $4 to $5 a day. But according to the exchange rate, this were the things. But normally the payment is not more than $5 per day.
All right.
And I just need all the people to know the rate. We are not using the market or the Zemabugulu, the Sukal Aswet. No, we are not using black market. We are using government exchange officially, because these documents will go to the donors. When you are liquidating, you have to put, yes, I take this $20 and I pay this money in the pound, but this is the exchange rate document, and need to come from what? From the central bank. Yes, that is what it is. So sometimes they will say, yes, they were been paying like now 3,000, 3,000 per day. He's seeing like something is a very small, but if you went to the rate of the government, that is the $5. $5 per day.
All right.
Yeah.
Now, before we give chance to our patient audience to ask their good question, I would like to invite Dr. Sule and Dr. Pati to let us know some of the side effects of this particular vaccines. First, Pati, and over to Dr. Sule.
Okay, thank you, Madrama James. Dear listeners, about as far as polio vaccine is concerned, it is 2 drops in the mouth, so it is one of the safest vaccines. It's not like injectables, because injectables, any injectable can cause pain, can cause swelling, but this one doesn't cause any effect. Rarely it can cause fever, but that is very rare. And like since I started this program, as I said, right from late 90s there, I've never experienced that a child was vaccinated with the oral polio vaccine and got serious side effects. So in case it happens, it may be fever, but that is easy to be managed with the cold spongings or paracetamol, something like that, so that it doesn't. But it is something safe, and it goes to the digestive system to clear the virus from the digestive system, because the child takes it through the mouth. Therefore, the vaccine has to follow the virus through the mouth to the intestines, so that it doesn't spread to the body system of the child, and the physics the child will defecate after the vaccination is safe, not harming anybody, even if it is outside.
All right.
Yeah.
Dr. Sule, any important point you'd like to put across before we invite our patient audience?
Okay, thank you very much. I think my director and Dr. Patti have all contributed to this adverse effect. Again, we want to emphasize that the vaccine is safe. So we call on all parents and caregivers to avail their children 0 to 59 months to receive this vaccine. However, we also want to note that in some counties, 3 counties, Awirial, Bor South, and Rank, there's going to be an integration with praziquantel. Praziquantel is a drug given to persons with infestation of schistosomiasis. So this schistosomiasis treatment, before giving,
before you proceed, of course, can you break it down for our audience? What is that schistosomiasis?
Okay, so schistosomiasis is a parasitic infection that enters body through the skin and spread through blood to other parts of the body. If you don't treat it, it could really go and damage some organs. Then it's also called bilharziasis. You see, even the people infected with it can pass bloody urine. You know, terminal, after urination, you see them pass blood. And with single treatment, you will not see that again. So you don't only treat it, but you save them from having complications that could affect, that potentially damage the kidneys. So that is why the leadership of the ministry, with support from the NTD department and the World Health Organization and UNICEF, thought it good to go to these counties with high burden of this disease. Right now, these drugs are also administered, but before taking it, there are some, requirements. There is need to eat before taking the medication. Otherwise, there could be potential adverse drug reaction. So it's important we emphasize this. And again, it's not given to children below 5 years. It's given to children above 5 years to 14 years, and also above the age of 15 in those who are at high risk, like fishermen, people who have who are exposed, that could really have it. So it's important we bring to the notice of the listeners. They should ensure to avoid potential the side effects. We have to make sure that these requirements are fulfilled. And again, I want to let you know, we have a system in place to monitor any side effect. And even if it's detected, we have a system that can manage and treat this side effect. So we are monitoring. There's a system called the AESI and also the AEFI monitoring.
What are those?
Yeah, AEFI means adverse events following immunization, and also adverse reaction, of event after administering this praziquantel. So we are monitoring. If there's anything, we act very fast, but we can, as much as possible, avoid it from happening. But otherwise, the vaccine, NOPV, is safe. As Dr. Patti mentioned, we rarely get reports unless if it's coincidental. Thank you.
Yeah, you mentioned something very important. To avoid further complications, people or children are advised, first to eat. Now, is there any specific food, like maybe that you need to eat this or that, or just any kind of food?
Normal meal, what they eat normally, not any special food, because the drug goes to attack the parasite. Remember, it's a parasite. Drug goes to attack the parasite, to destroy it. So if there's nothing in the stomach, you know, that interaction between the drug and the parasite could also affect the host. So that's why it's important to have some.
Yeah, I asked that based on also the report we got yesterday, where about 7.5 million people would face that's acute hunger in lean season, April to that's July 2026. Dear listen up to here, let's first head out for our first commercial break. When we come back, that's when we shall be giving you a chance to call us on 0911-022-986 and 986.
في سنة 2025 سلطة إيرادات جنوب السودان بدأ فصل جديد في تاريخه الاقتصادي. قروش الليموت إيرادات الشهري كان مسهل، وصل ل 130 مليار جنيه جنوب سوداني، ونجاح ده برجال للتحول الإلكتروني أو الرقمي. برنامج المعروف بإي جوفمنت اللي كان عملوه في مستوى البلد كله في سنة 2021 الطوروا شغل الخدمة العامة البقى حديث، وعززوا أنظمة بيانات، وسيبوا لمتقروش تإيرادات أسرع وآمن وأكثر شفافية. الليلة حالات فساد ناقصوا وكفاءة زيدوا، وكل دفع أو تحويل الإلكتروني يشيلوا بلدنا أو أمتنا تجاه استقرار وازدهار لناس كله. سلطة الإيرادات جنوب السودان بينادي كل الهيئات الحكومية وشركاء التنمية والمواطنين عشان هم بيستعجلوا ومن بيشتغل نحو التحول الإلكتروني الكامل. سوا من خلال التحول الإلكتروني والتعاون جنوب السودان بيقدم لقدام، بيكون أقوى وأكثر شفافية وكمان أكثر اتحاد من أجل التقدم. سلطة الإيرادات في جنوب السودان، رقمنة الإيرادات ودفع عجلة التنمية.
Itabagda Diamond Wenisu ma iRadio ala nimrata telefon 0911-986 au itabiresilu risala ala nimra 0913-986.
نعم، في زمن بتصل عندك سؤال خاص لضيوف بتاعي في داخل الاستوديو، وتصل معنا وشارك يا سؤال ولا تعليق بتاعك في 0911-228-696 ناس قاعد بناقش في انه تتعيم بتاع بوليو، هل كأم ولا أبا idea to sual bezat altadararu fi dakhil studio indina mudir min usara saha wa kaman shuraka bita usara saha. Hi radio
Madrama James.
Ustaz Tolfuk.
Absolutely, this is me Tolfuk.
Naam.
Ana busalamita والضيوف القاعد في الاستديو كمان.
شكرا.
باسم جنوب السودان ورب الخلا أنينا الجنوبين. أول حاجة أنا مقصود لأنه هاي راديو بيجيب لنا معلومة في المعلوم، ومعلومة ده يعني مواطنين بيستفيدوا، وأنينا زي الريجولار سكولرز بيستفيد في المعلومة. أول حاجة لأنه في جنوب السودان حاجات بعمله في الكشم وباقي ما في يد الناس المسؤولين، وتنفيذ بتاع قانون. عشان كده الجنوب يعني ما في اتجاه يكون ناجح فوقه، أمراض بجاي، صفاف بجاي، كمان الناس يكون نهاو بجاي، شوارع كرب حاجات. لكن أهم حاجة في البلد لازم الساعة بتاع الإنسان يكون 100%، لأنه لو أنت شاهد ملاري بقتل الناس، ملاري الزيتية ده ملاري ساكت، ما ملاري بيكون ملاري تايفود، ملاري ساكت ده عشان شنو؟ ما في دواء هناك. كمان هنا ما عندنا دكاترة يعني يكون عندي فيلم عشان ده على حاجة في جسم الزول شنو، وبقول ده ملاريا ده كيف.
نعم. طيب سؤال بتاعك شنو لمدير بتاع وزارة الصحة وكمان الشركاء؟
أي سؤال بتاعي كده، هل هذا كامبين بدأ؟ الكامبين ده في داخل الجبهة ولا في 10 ولايات و3 إدارات. ولو في 3 إدارات و10 ولايات هل الناس القاعدين هناك انتم متأكدين بعمل شغل انتم قاعدين تتكلم فلسطين ده؟ لأنه بمشي في المال، لأنه زمان في الكوليرا. الكوليرا ده يعني عمل 2 مع ناس يكون يعني قتل ناس في 2 وكامبين فيه، لكن كامبين ده ما ماله. هل انتم متأكدين الكامبين انتم بعملوا ده يعني بيتم بمشي لجراس روت عشان تلقى الجنة يعني يكون دايره عشان يكون تلقى الدواء عمره 5 سنة يعني بقبل عشان يكون في المال عشان نازل يعني يكون ما في زول بقول مش في شك يعني في بعض الجزء بقول نازل ما بشيء ما بيجي حتى بتاعنا، وكمان وفي ناس بقول نازل يعني الشغل بتاعهم ما في مال. انتم قاعدين عشان
براقبه
يكون امشي في شغل الزول الوطني.
نعم شكرا جزيلا أستاذة الفوكينا في جوبا، وسؤال بتاعك في محله. نعم ديو بتاعي في داخل الاستوديو بشيل فرصة له وكمان بجوابه السؤال بتاعك. ناسمة من دي هاي راديو. أستاذ ويلي من لولوغو 1.
هيا سلام لك إنت وسلام لك جيتنا في الراديو أسأل المحترمين الاثنين أسباتي وإنت كمان يا منى.
شكرا.
يلا كمان أنا بدي أقول له طبعا ممكن كلام كويس عن البوليوم أو التطعيم كويس باللغة العربية التطعيم باللغة الإنجليزية هو البوليوم. يلا طبعا أنا ما أعرف الحصة اللي قاعد يجيهم ده طبعا الحصة ده طبعا بيجيهم هناك طبعا في كان زمن تعيط ده يجيبوها ما بيجيبوها، لكن طبعا أنا سكان كده فيها غيرها بتاعنا من الدول بتاعنا القاعد ده طبعا نقول لها يا أخواننا أنا بقول لها أجانب هنا قلنا ده نقول لها أخواننا دول الجوار دول خلص التطعيم اللي بيجيبوها دول بيشمل كل بيالهم ولا بيشمل لنا الجنوبيين برا فقط. لا التطعيم بيتم باسم تا دولة حقنا، التطعيم تا سياسي دولة الجنوب طبعا جاوين من برا أصلا يا ما حقنا جاوين من برا علينا ليالنا ده جاي يلا بيشمل كله حتى الأغرباء بتاع دول الجوار دول معنا موجودين معنا بجاي ما في أريتريا في أوغندا في شنو وأنت ما لازم ما بتاعنا لكن ده الأغرباء بتاعنا كلنا ما مساوي يا كانوا في تطعيم ولا في سوري الاثنين انا ما اعرف طبعا في مخازن انا شايف مخازن كبار تمديدات كمان تمديدات الطبيه هنا يلا الدواء ده اللي وجايبين من برا ولا قالوا جواني.
نعم دواء زي شنو قلت؟
مخازن كبار كده يجيب انا شايف قال لي مخازن ادويه وشنو انا ما اعرف قال لي تدوي جواني ولا برا لانه كل الناس دائما يعتنون طبعا بيقول لك الدواء ده ما بيشيل عيان ده برا لسه العيان يجي في الجسم انا ما اعرف كيف يعني دي قالت يا بلد.
شكرا أخونا ويلي وسط مشاركة. نعم ده كان ويلي من لولوغو 1 راديو.
Madrama James.
Good evening, David Magog.
Let me welcome your guest in the studio.
Thank you.
We appreciate that explanation. And we would like to appreciate them. They have really taken care of the children around the country. But I have some few questions to them. Number one, there are places that have crisis currently, like part of Western Equatoria, part of Upper Nile, and those children are in need to be given such vaccination. Now, what is the plan for the ministry to reach those children? This is number one. Number two is about the awareness. There are other South Sudanese who are refusing that medicine for their children not to be vaccinated. What is the right channel or the good language that you really translate it so that they will understand the goodness of the medicine? Thank you.
Thank you very much, David Magog. Plans for that had to reach areas, and then parents who are also refusing their children to take this vaccine. What plan or alternative? Last caller for now. I radio. Alhamdulillah. Marhaba garang. Intikabat?
Intikabat anin dari nazar intikabat. Ajan intikabat anin kulun dari nazar intikabat.
وهذا كله مواطنين تعبانين. في ناس تعبانين في مستشفى، في ناس تعبانين في جو، في ناس تعبانين في شغلات ثانية. وزلت لازم بقي ما في رادمية بقي الناس كله تعبانين. حنين دايرين عشان هو يا حكومة يجيب مع مواطنين، يجيب مع أي كل الناس قاعدين في مستشفيات عشان يصلوا، عشان بعدين انتخابات كان دام خلاص الناس بكون يوم ناس بكون فرحانين. لكن ناس ثانيين تعبانين بموت في مستشفى، وفي ناس تعبانين جعانين، وفي شواري ما تمام. كيف بعدين انتخابات خلاص قرب نعمل شنو؟ بعد انتخابات الناس كلهم مزاجين.
نعم.
نعمل شنو؟
شكرا. شكرا وزارة صحة ومدير جورجي معي في داخل الاستوديو. وسط زمن أنا بقول خلاص قرن يكون آخر مخالمة بتاعنا في الزمن بتاعسي، أو أنا بيبدأ مع مدير جورجي تعليق بتاعك في أسئلة المستمعين هسال. مرحبا.
اوكي شكرا جزيلا. انا في بدايه بدي شكر لكل المستمعين بتاعنا القاعدين يتابع برنامج، وده بوري انه ممكن بيتابع برنامج بطريقه ادق. اللي انا داير نقول في السؤال الاول بيسال انه الحمله الحصه ماشي ده حل هو في 10 ولايات و3 الاداريات. الاجابه يس، نعم يا اخويا، الحملات ماشي في كل 10 ولايات بتاع جنوب السودان و3 اداريات. الفرق هنا وين؟ ان احنا مستهدفين، لو انت تابعت برنامج من البدايه، ان احنا مستهدفين 40 كاونتي في داخل 10 ولايات و3 اداريات. احنا مستهدفين ل 3 كاونتيز ديل قبل ذكروا انه ال 40 كاونتيز ديل اللي احنا استهدفناه ده عنده التغطيه متدني او تغطيه بتاعهم تعبان، يعني العيال هناك كتير ما لقوا تطعيمات. ده واحد من الاسباب اللي خلينا احنا اخترنا 40 كاونتيز ديل. حاجه الثانيه انه هل البرنامج ده بيقدر يصل لحد الجراس روت اللي هو ارض الواقع؟ الاجابه نعم. ما احنا شغالين بالنظام بتاع الحرم. انت لو بتفهم الحرم يعني احنا في قمه، وبعدك احنا بننزل تحت، ومن تحت لحد احنا بننزل في القاعده بتاع هنا زي ناشونال ليفل. احنا بنشتغل بستيت، وستيت بعدك بتمشي للكاونتيز، وكاونتيز هو ياو منطقه بتاع تنفيذ، هو بيجمع كل الفاكسينيترز، بعدك هو بيوزعوا على حسب شنو الخطه بتاعه والتغطيه السكانيه اللي هو السيتلمنت، هو بيمشي لمحل ده عشان تخطي كل الناس. بظروف الحاله اللي احنا فوق ده، حاله احنا بنقدر نصل لمحلات ده كله يس. عشان كده احنا عملنا حمله ان احنا ما اصلا كل يوم عندنا شنو، عندنا روتين في المستشفيات، لكن الناس ما قاعدين يجي. احنا عملنا حمله لانه حمله بتجي مع حاجه اسمه ايجابيات. الايجابيات ده شنو؟ الحمله بتجي بقروش زياده. القروش زياده ده بيخلينا احنا بنأجر عربات، بنأجر طيارات عشان يوصل الفاكسين ده في محل المفروض احنا دايرين يوصل فوقه. عشان كده عملوا سموه اسمه حمله. when you are talking about the campaign ما حاجه صغير، يعني انت بتعمل حمله عشان تمسح كله شنو التغطيه بتاعك، وانت لازم تصل فوقه في ارض واقع. وفي سؤال تاني بيقول الطويه تعبان. يس، طويه فعلا تعبان. احنا شغالين لما تكون في كامبين زي ده. هسه وجود بتاعنا في استوديو ده جزء من الطويه. احنا دايرين نرفع وعي بتاع الناس عشان يفهم اهميه بتاع الفاكسين ده شنو. الفاكسين ده بيدي مناع ده عشان يعمل شنو، عشان يحمي الجناح ده من شنو، من شلل الاطفال. انه الفاكسين ده بيخطي كل الناس في جنوب السودان والاجانب وكده. الاجابه نعم. الفاكسين احنا وقت نعمل اي زول خش جنوب السودان الليله ده احنا بنديه تطعيم، الا لو جنب ما عنده جنب بتاع شنو اندر 5. اي جنب اندر 5 من عمر يوم لحد 5 سنة داخل البقعه جغرافيه بتاع جنوب السودان هو لازم يحقد، لانه لو احنا خليناه برا هو بيجي مصدر بتاع الايان بكره. عشان كده اي جنة داخل البلد ده احنا بنديه، ده مسؤوليه بتاعنا كحكومه بتاع جنوب السودان. بنديه اكزاكتلي زي ايال بتاعنا في يوغندا، في كامبالا، في كينيا، وين في امريكا بيدوا لهم فاكسينز. ده نفسه حاجه. سؤال تاني بيقول هو شايف مخازن مليان في جنوب السودان ده. اللقاح ولا فاكسين ده قاعدين يعملوه في جنوب السودان؟ أنا بقول لك لا. فاكسين في إفريقيا كله، في إفريقيا في المغارب قريب 3 مصانع بتاع فاكسين ولسه جديد، ده في إفريقيا كله. فاكسينز قاعد تجي من أوروبا وآسيا. فاكسين ده لأننا شغالين فوقه هسه ده جاي من 2 محلات، ده في جاي في أوروبا وجاي من آسيا. ده فاكسين اللي احنا شغالين فوقه. لما انت تشوف مخازن بتاع اللقاحات عنده سيستم في درجة حرارة معين لازم يحمو. هسه كان انت هنا الناس بتاع كامبين ما في زول شايل كامبين في جيبه ولا في كيس ورا، انت بتشوفه عنده بوكس. الصندوق اللي هو شايله ده اسمه حامل اللقاحات. الحامل اللقاحات ده بيشيل فاكسين ده عشان يحفظه بطريقة الصح عشان يكون فعال في جسم بتاع جنة. ده التغطية. نقطة تانية في زول بيقول بلد فوقه كوارث والمشاكل كتير وكده، حالا نحن بنصل لمحلات ده كله؟ الإجابة بتاعي نعم ولا. إجابة نعم، إحنا بنصل لأي محل ما فوقه خطر بتاع الأمن، يعني إحنا بنصل هناك، وإحنا ده مسؤولية. المسؤولية بتاعنا نخطي كل البقع بتاع جنوب السودان. لازم الجنة ده يصل له تطعيم في محل اللي هو قاعد فوقه. يعني نديك مثال بسيط، أسبوع الفات أن عندنا تيم قام من هنا بالطيارة كامل مشى في لونغتشوك وناصر وولانغ عشان يطعم عيال هناك. ده لأنه الوضع الأمني هناك حسا بقى كويس، عشان كده احنا رسلنا تيم بطيارة كامل. احنا بنخطي لعيال أي جنة في داخل جنوب السودان ده عنده حق عشان هو ياخد التطعيم. التطعيم اللي احنا قاعدين نديه ده شنو؟ التطعيم ده آمن وفعال، وده حق بتاع جنة ده عشان ياخد التطعيم للتطعيم.
أنا بندي فرصة لأخوان بتاع ذات وسط زمن بال كمان برضو بابا يال بتمن عشان ياخد فاكسين ده.
يس أبو هذا البيابا يال بتمن جبال ونسو كلام تاني جبال للناس الماسمو. أنا قلنا فاكسين ده ماله هو آمن وفعال. احنا بنتمنى من كل الأمهات وأبوهات وأولياء الأمور إنه يسمع لعيال بتاعنا يطعموا. جبال انا اديت مثال انه حزب زمان بيقتل العيال بتاعنا، كوت زمان بيقتل العيال بتاعنا، كوت زمان بيعذب العيال ما بينوموا، لكن الليله العيال بتاعنا بيكون بيقى شنو في الصحه وعافيه. عشان كده الفاكسين ده فعال ومن ما يخافوا، الحكومه شغال من اجل بتاعهم. شكرا.
Now, dear listener, because of time, we have officially come to the end of our conversation talking about the campaign of that polio vaccine. My guests in the studio, Dr. Pati, Dr. Sule, and Mr. George Awizenio from that's the National Ministry of Health. I am your host, Madrama James.